Babies. Is there anything more endearing than the coo of an infant or the beaming smiles of new parents? Babies even bring joy to our most mature citizens. Babies have the ability to make everything right in the world. And at St. Cloud Hospital, there's a rich history of bringing these small wonders into the world. Dating back to the early 1900s at St. Raphael's, amazing deliveries ushered in the new century. In fact, it was on November 9th, 1909, that the first successful cesarean section was performed at St. Raphael's. The delighted and grateful mother, Mrs. Hoffer, appropriately gave her son the middle name of Caesar. And 1928 was a big year for babies. 4 sets of twins were born at St. Raphael's in the month of February alone. This was just 1 week before the new St. Cloud Hospital opened for patients. The first baby born at St. Cloud Hospital was William McDonald, who arrived on February 16th. The Benedictine sisters were magnificent caretakers. Even back then, student nurses made up a significant percentage of the nursing staff, often looking after the newborns. Although the delivery rooms and equipment have drastically changed over the years, one thing has remained constant: a strong commitment to growth and technology. 1939 saw the St. Cloud Hospital purchase its first incubator called the Humidicrib. Incubators were very important in saving the lives of premature babies, as it allowed for the regulation of the baby's body temperature. While the 1950s gave way to rock and roll, the Edsel, and I Love Lucy, St. Cloud Hospital births were booming, with a record 2,312 babies being born in 1951. Dr. Francis J. Schatz delivered his 8,000th baby on December 21st, 1951. He would go on to deliver more than 9,500 babies in his esteemed career. On November 20th, 1953, Dr. Louis A. Less opened the first practice of obstetrics and gynecology, specializing in maternity cases and women's diseases, bringing a specialty to St. Cloud Hospital. And another milestone came to St. Cloud Hospital in 1953 as Mr. and Mrs. Everett Krantz delivered the first triplets. The proud papa shared his joy and cigars with his pals. And not to be outdone, Mrs. Robert Jennings gave birth to her triplets in 1955, all 20 pounds of them. And let's not forget about the early marketing department, who were always on the forefront of promoting St. Cloud Hospital. In this early campaign, any baby born on New Year's Day would receive 6 free days of hospital care. Now there's an incentive for a New Year's baby, and in fact, 10 babies were born on January 1st, 1954. And through it all, high-quality care was the driving force. In 1954, a baby girl weighing just 21 ounces was born and survived, much due to the improved technology and training of the staff. The 1960s gave America the Civil Rights Movement, the Fab Four, and Star Trek. And at St. Cloud Hospital, it brought in Dr. Don Heckman and Dr. Steve Summers, the founding fathers of pediatrics in our community. And with that concentration on child health care, education and training became a major focus. And the results were remarkable. 1965 saw the first successful prenatal blood transfusion. And we also saw the switch to instant infant formula. Continuous fetal monitoring was introduced, helping doctors and nurses get a better picture of what the baby was experiencing. And as central Minnesota continued to grow, it quickly became evident that more space was needed to handle the changing needs of parents. In 1968, a major expansion included 4 new nurseries, each protected by an alarm system on the hallway door. And although neonatal care was still developing, the survival rate of preemies was on the rise. While many were living with disco fever, the 1970s saw major advancements in child health care and policy. While America was celebrating the bicentennial, fathers took a stand to be more involved in the delivery process. Prior to 1976, fathers were not allowed in the delivery room due to concerns over hyperventilation and the distraction of mothers. But after a heated public debate and a class action suit brought against the hospital, the decision was made to allow husbands in the delivery room, only after they received approval from their doctor and gone through the hospital's training course. In 1979, it was decided that unwed fathers or some other person chosen by the mother could be part of the birth. As Reaganomics ushered in the 80s, another expansion took place in the maternity unit, including 28 private rooms. More privacy allowed mothers and families to share in the infant's first days of life. And what about those dads? Well, they could be found on gym floors throughout central Minnesota, actively participating in childbirth classes. Along with the expansion came St. Cloud Hospital's entry into neonatal care. In 1988, Dr. Norman Vernig became the first neonatologist on the medical staff. Prior to his arrival and the opening of the first NICU, infants had to be transferred to the Twin Cities to receive higher levels of support. As coffee shops started popping up on every corner across America, the 1990s saw major advancements in NICU and child care at St. Cloud Hospital. Another renovation created a new and expanded 19-bed neonatal intensive care unit, complete with an isolation room and more privacy for patients, family, and staff. Dr. Chip Martin joined the staff as a neonatologist and pediatric cardiac specialist in 1999, giving St. Cloud Hospital a marked presence in neonatal care. As the world welcomed in the new millennium, St. Cloud was preparing for the new CentraCare Health Plaza, complete with a women's and children's center offering a short-stay unit, pediatric rehabilitation, and pediatric behavioral health and specialty services. And at St. Cloud Hospital, the need for advanced neonatal care in private, state-of-the-art birthing rooms became much more in demand. As the needs of our community continue to change, St. Cloud Hospital remains at the forefront for innovation, technology, professional staff, and quality health care. The new expansion of St. Cloud Hospital is evidence of a century-old commitment to quality health care in central Minnesota, a commitment to families, and most importantly, a commitment to babies. St. Cloud Hospital. This is your hospital.